What causes vaginal spotting during pregnancy? Pregnancy spotting in the first trimester of pregnancy is a normal pregnancy symptom, and it is nothing to be worried about. Though it is obvious after having the confirmation of pregnancy through a pregnancy test, the woman worries a lot on having its menstrual-like spotting, but the medical professionals believe that it is a normal condition. This pregnancy spotting can take place somewhere between the 7 to 9 weeks of pregnancy. This pregnancy spotting takes place when the embryo tries to attach itself to the lining of the uterus. The pregnancy spotting is also termed implantation bleeding. The implantation bleeding or pregnancy spotting is also considered one of the earliest pregnancy symptoms. Mild pregnancy spotting from the vagina is nothing that should be worried about. But if the bleeding is heavy or is accompanied by abdominal cramping, it should be better consulted with the doctor. Pregnancy spotting. What does pregnancy spotting signals? Pregnancy spotting is completely normal and harmless in the first trimester of pregnancy. However, if the bleeding is slightly more, it may signal some serious problem in the expectant mother. Normally, if pregnancy spotting is greater than normal, the pregnant mother is sent to the line of screening tests to ensure that both the mother and the baby are in perfect health. So if the expectant mother has pregnancy spotting slightly more, it is always better to rush to the gynecologist or to the nearby emergency section. Cause of pregnancy spotting. There can be many reasons that lead to the pregnancy spotting in the first trimester. This spotting is different in appearance from the regular menstrual period. The reason of this pregnancy spotting is the increased supply of blood to the pelvis area and cervix. The color of pregnancy spotting varies from pink, deep red to brown. Medical professional gives the following explanation of the pregnancy spotting. When the fertilized eggs attach itself to the wall of the vagina, slight pregnancy spotting may take place as the result of this implantation. The embryo attaches itself to the lining of the uterus after 5 to 7 days of fertilization. Pregnancy spotting. Implantation of the fertilized eggs anywhere else than uterus causes pregnancy spotting with abdominal cramps. This signals ectopic pregnancy. Sometimes the fertilized egg begins to grow outside the uterus in the fallopian tubes. This is the reason that ectopic pregnancy is also termed tubal pregnancy. In such a case, it is essential the pregnancy spotting should be immediately reported to doctor so that he can take necessary steps to save the life of the expectant mother. There can be some other possible causes of pregnancy spotting, like it can be because of some infection like vaginal infection, bacterial infection or some yeast infections. Most of the times these infections are not as dangerous or alarming as the ectopic pregnancy, as they can be treated with the doctor's recommendation and does not end up with the termination of pregnancy. Still, there can be some fatal sexually transmitted disease like chlamydia, gonorrhea and herpes. To avoid any further complication, it is better to report the pregnancy spotting as early as possible to the doctor.